This is how criminals usually use drugs to either steal from you, kidnap you, and in worst cases, the rape cases. Now, the aim of the drug is either to make you go unconscious or you lose your free will. Now, this is when they can just tell you anything and you're just going to do that. They're going to tell you, hey, go to the bank and withdraw the money and come back with exactly the same money. You're going to do exactly that. They tell you, hey, give us your PIN number. They are just going to give us your password. You're going to do everything that they're going to tell you. Now, we have several types of drugs. And today I'm going to only focus on two because these are the popular ones. They are used in public transport, and this is so notorious, by the way. Others are used in, almost the same. In public places, someone meets you on the road, they do something to you, you follow them, or maybe you just fall unconscious and they steal from you, or they do whatever they want to do with you. We have clubs, and this is another very notorious place. Now, I'm not talking about the spiking of the drinks because we're going to talk about that in the future. This is when someone comes and sprays or make you smell something, and then from there you go unconscious, or maybe you lose your free will. Now, we have two drugs. Okay, in the Kenyan market, we have so many of them, but we're going to focus on two. I think it's popular to them. I think it's easily accessible, or maybe they can be able to accomplish their mission without making a scene. Now, we have the first drug, which is heroin. Now, this one, they'll try their best to make you inhale this drug. Once you do that, you're going to fall unconscious. Now, let me give a scenario in a setting. They mostly use the same script. Now, you're in a public transport, especially. They usually target those who are sitting close to a window. So you're seated there. Someone comes and sits next to you. What they're going to do is they'll start trying to engage you in a conversation, and because maybe the window is open or even closed, they're just going to use any of those scenarios. So what they're going to do, they're going to lace this side of your hand here, any part of your, so long as it's around here. So they'll just pretend that they're becoming friendly, and they're going to apply that thing here. I don't know how they do this, but they're going to distract you so you're not going to notice. And then they're going to tell you, hey, open the window for me because I'm feeling the room is so hot. So just try to open the window. Or if it's open, so they're going to tell you, hey, help me close that window because I'm not feeling okay. So by default, what you're going to do is you have two hands here. But the most efficient one will be this one, because you see, you're seated next to the window. So it will be hard for you to just use this hand, go grab the window, the window pin, and try to pull it either open or push it to close it. Now, by default, you're going to use this hand to try to either close or open the window pane. Now, you definitely see where we are headed. Now, this is where the lacing was done. What you're going to do is you're going to smell this drug. And within some few minutes, the maximum will be 5 minutes. Actually, it doesn't even go that far. So in less than 5 minutes, you are unconscious. So they carry anything they want to carry from you or steal from you. And that's that. Now, there's another drug called scopolamine. This is a very notorious one. Someone will come to you and make you inhale this drug. Once you inhale, you're going to lose your free will, and they're going to take you wherever they want. And then after taking everything from you, then you're going to gain conscience later. And at this point, whether you took halodane or even this scopolamine, you're going to have a very severe headache. Extremely severe. So once you discover that you are drugged, I would advise you to always make sure that you drink a lot of water. Anyway, be safe out there. People are out there, they're using drugs, and the criminals are not sleeping. They are going to devise a very clever way of distracting you, so they are not going to know when they are lacing you. One of the things is someone is trying to make you open the window. Like, for example, if someone is telling to open the window and maybe you notice that they were very touchy when it comes to this other hand, you know how public transport seats are. They're very tiny, so you're going to sit here and someone is just here, you're squeezing each other. So you don't know what will happen. So if someone tells you, help me in opening the window, so don't use this hand, use this other one here.